Hi, I'm Dr. Eric Balcavage and welcome back for another edition of Thyroid Thursday. Today I want to pose this question, and you've probably heard this if you've been frustrated with thyroid physiology and in the past and you're struggling with some hypothyroid symptoms, that you know what, I know you have a lot of symptoms, but really you're pretty healthy, right? Your doctor does a limited thyroid panel, TSH, maybe a T4, those values come back into normal range. And he says that even though you have all these symptoms, that you're really pretty healthy. And so your guidance from your doctor may be you just need to exercise more, you need to eat less, you need to get more rest, and you need to reduce your stress. And if you did those things, probably your symptoms go away. But because your TSH is normal, it's definitely not a thyroid problem. Well, that couldn't be further from the truth. Well, let me say it this way. You may not have a thyroid glandular problem, which is really what your doctor is looking for, but you very well may have a tissue hypothyroid problem. And what that means, as I've described on previous videos, is that you're struggling to get thyroid hormone from the bloodstream into your cells. And that's when hypothyroid symptoms start, not when the gland first starts to struggle to make thyroid hormone. It's thyroid symptoms really start when you can't get thyroid hormone into the peripheral cells. That's what triggers all your symptoms. So unfortunately, TSH and T4 don't represent the tissue level of thyroid hormone. And in traditional medicine and endocrinology, they're not looking for the tissue level of thyroid status. They're looking to see if the gland has become diseased and dysfunctional. And part of the reason for that is that the only treatment option they really have is to give you more thyroid hormone. They never look at the mechanisms that prevent thyroid hormone from getting from the bloodstream into the peripheral cells. So if you have symptoms, you don't feel good, you're tired, you're fatigued, you're struggling to maintain your weight because your weight's going up with really no change in dietary habits. If you're chronically tired and fatigued, you can't sleep at night. If your skin's dry and your hair's falling out, you have a thyroid problem. It's not the gland, but it's probably at the tissue level. And so what you need to do is you need to find somebody like me who works in the world of functional medicine to not just look at this limited view of a TSH and a T4, but to look at your whole story, to look at a complex thyroid panel, to look at a complex comprehensive metabolic panel, so that we can see not only if you have a tissue thyroid problem, but what some of the mechanisms might be that are causing that tissue hypothyroid condition. We also want to look at your history. Your history is your story from the time you were born to present day, all the things that have happened to you, all the treatments, all the infections, all the antibiotics, all the stressors of life, they all contribute to your current state of health. And so we want to look at that history, that story. And by combining your story and your history and the previous treatments and your lab findings, we can identify what's the root cause of your thyroid symptoms or the symptoms that you're experiencing, whether they're related to a cellular or tissue thyroid problem, or maybe it's even more advanced. Maybe you have Hashimoto's, or maybe you have full-on glandular dysfunction or disease, or is it something else? And if we can identify what it is and why it's occurring, then we can come up with a treatment protocol to help you fix the underlying causes, reduce your symptoms, and regain your health. And we've been doing that in functional medicine, and I've been doing that in my practice for the last 15 years. So if you have some symptoms that you believe is a thyroid problem and you want to talk to somebody about it, there's a link below to schedule a complimentary consultation with me on a Monday, Wednesday, or Thursday during my lunch break. Or if you know you want to be a patient, you can call my office at 610-558-8920 and ask my staff to become a patient, and they'll get you all set up. So hopefully this helped. I look forward to talking to you on another Thyroid Thursday. Take care.